Good morning, good afternoon, and good evening, and welcome to the Therapy Matters podcast, your one-stop resource for expert insights and advice on everything therapy and rehab. I'm your host, Allison Jones, and today I'm joined by Scott Owens, the founder and owner of BluTinuity. Scott, thank you for joining me today.
Thank you for having me, Allison. I'm excited for our discussion.
Me too. So, Scott, to help set the stage for today's conversation, just take a few minutes to give our audience some background on who you are and tell us a little bit about BluTinuity.
Happy to do that. I am a management consultant who, first and foremost, is passionate about helping organizations understand their risks and helping them plan and prepare for what they hope never happens. I have certifications in information security and privacy through ISACA, business continuity with the Disaster Recovery Institute, and I'm also a certified project manager through the Project Management Institute. And all of those have helped me and with a really good understanding of business and then how to help organizations. My company, BluTinuity, really focuses on assessing information security privacy risks. And this includes things like regulatory compliance, technology environments, physical security, people-related risks, and so on. And I've got about 30 years of experience doing these types of assessments using a variety of security frameworks. HIPAA is the one that everyone's heard of course. CMS, NIST, cybersecurity framework is another very popular security framework, and others. And I do dozens of security risk assessments on an annual basis.
Excellent. Well, thank you for that background. So, as you mentioned, your team assists organizations to become better at understanding risk and protecting their data and their assets. And that's what we are going to discuss today. And specifically, what we're going to dig into a little bit deeper is security risk assessments, or SRAs. So, a little bit of background to sort of set the stage for today. So, last November, CMS published the calendar year 2024 physician fee schedule final rule. It's a 1,200-page document that spells out the future of regulatory compliance for clinicians who accept Medicare payments. It covers a number of areas, but notably, in this ruling, the upcoming MIPS performance year will bring many important changes for the PT, OT, and SLP community. So providers are going to now be required to participate in the promoting interoperability category of MIPS. And this is something that has, for the past few years, has been automatically related. So it's a big change. And under the promoting interoperability category, there are a number of sub-requirements for it to meet the attestation. So a few of them are you have to have a minimum reporting period of 180 days, you need to be on a certified EHR, and you are required to complete a security risk assessment. And since this can be a newer process for some of our listeners, we want to dive in and learn what a SRA is, why it's important, how it's done, how it can help your organization, and everything in between. Okay, sound good?
Absolutely.
All right. Okay, so let's dive in. So first question for you. What is a security risk assessment?
So that's a great question. A security risk assessment is really a structured approach to evaluate the level of maturity of an organization's information security program. Typically, it's measured against a recognized security framework. Earlier, I mentioned the HIPAA security rule, the NIST cybersecurity framework, ISO 27001. CMS has an acceptable risk safeguards that include security and privacy, and there are many others, but it's important that you use that as a baseline. In addition to a gap analysis against one of those security frameworks to make sure that from a compliance standpoint, you're on target or you're following best practice, is that you specifically want to make sure that you identify and rank the unique risks to the organization. So as an example, one risk that many organizations should be looking at is what would happen to us if we suffered a ransomware attack. and trying to understand, are we really at risk? What's the likelihood, and what would be the impact of that happening? So it's really two pieces of a puzzle here that are important.
So you mentioned ransomware attacks. How frequently do those happen in healthcare?
Quite often. In fact, I subscribe to a number of newsletters where I receive information on all the latest data breaches, and you don't always know about them. They're not always public knowledge, unless it's a data breach that involves patient information, in which case the HHS. OCR, the division of the Office for Civil Rights, which has the authority to oversee HIPAA, will eventually find out about this because you're required to report a data breach of that nature. And if you have a ransomware event, typically the way those work is all of your data is encrypted, and the bad guys ask for a ransom a very large sum of money to get there for you to get your data back. They typically know how much you can afford to spend, either by understanding what your cyber insurance looks like or whether they have an idea of your cash position. And so, as an organization, really understanding what that risk looks like, and then knowing also what you're going to do, when you encounter that. How often did those happen? Some statistics would say that 1 in 2 organizations in the course of a year have some sort of security or continuity incident. Now, that doesn't necessarily mean ransomware, but it does mean that organizations are at risk for some sort of event that causes widespread outage or concern. So the risk is high. It's probably the single greatest thing that organizations are focused on right now in protecting their data and their assets.
And healthcare in particular is a one of the leaders in terms of ransomware attacks, correct?
It is. It's frightening, and that's backed up by there's a survey that's done every year by IBM and an organization called the Ponemon Institute, and they survey somewhere in the neighborhood of 4,500 organizations all across the world to better understand data breaches. And they will through the analysis and all the interviews that they do, and there's literally thousands of different interviews. The data that comes back and identifies a number of key facets, and one of them is that the average cost of a data breach in healthcare in the United States is almost $11 million. Healthcare is almost 50% higher than any other industry in terms of the cost. And the United States is more expensive than any other country in the world. And there's a number of reasons that probably go into those factors, but just based on the sheer cost alone would give you some indication of what that looks like.
So it's important to have a security risk assessment and understand your vulnerabilities and how to protect against this.
It absolutely is. I think an organization is not in a position to be able to mitigate or plan for some of these if they haven't done a risk assessment and they really don't know what they're dealing with. Every organization is totally unique, and you might say, everyone is vulnerable to ransomware, and I would say that's true. But some organizations have gone to great lengths to reduce their risk. For instance, they might install anti-ransomware software, or do extensive training for users, because more often than not, ransomware gets started when someone in your organization clicks on something in an email that they shouldn't. And so there are things that can be done. There are good practices that should be in place, but really it all starts with the risk assessment, because you don't know where to go or where to start unless you have a baseline.
Walk me through how a security risk assessment is completed.
Sure, and this is what I'll share is the methodology that that we use at BluTinuity for a security risk assessment, and I would say this is a tried and true approach that has served us well. We've been in business for almost 13 years, and so there's a number of pieces to this puzzle. The first one is that we always want to take a look at documentation that an organization has. So we'll send a document request list, and there could be as many as 100 documents that we'd love to take a look at. And that includes policies, procedures, org charts, really any documentation, technical in nature, that gives us some insight to how well the organization manages its security and privacy. And so those will be shared up front, so we get a chance to really understand the business. And then we facilitate a series of interviews, and that will include various leaders in the organization in major disciplines. Mostly it's security and technology, but there are a number of question lines that also pertain to controls in human resources, physical security, and so there's some other disciplines that are involved. We walk through the respective security framework that we agree on is going to be important, and this framework may require, for instance, that we evaluate your password policy. And we'll discuss the specifics of your password policy. What does your written documentation say? How have you implemented it across all of your systems? Is that consistent? If you're an organization that's large and you've got, for instance, I have a hospital client that might have close to 400 systems that are in use across their system, and their password requirements are not the same all the way across, and that could be an area of risk. And we'll compare what you've done to good practice and the standards that have been outlined. And then I'll offer some coaching, through what the expectations are. And, if you came back to me and said, well, we only have a 4-character password on our electronic medical record system, I would say, in 1996, that's probably perfect.
Hmm.
It's better than most. But today, that would be woefully inadequate. And so, we would talk about what's good for today and some of the things that you would, really need to implement and how to bridge that gap. As we get into these interviews, we'll look at topics like security roles and responsibilities, policies and procedure implementation, risk management strategies, vendor risk management. Here's one that really has become important over the last few years is you may have a well-organized security program and a very mature program, but if you're sharing data with vendors and they have access to some of your systems, do you know that their security is equivalent
Mm,
to yours, or at least meets your requirements?
right.
We'll look at asset management, access controls, training, awareness, incident response, the very long list of topics that we'll get into. All the while, conforming to the cybersecurity standard that we have been talking through, and trying to understand all of your assets, systems, software, technology, laptops, tablets, phones, any device that is in use. We've got to understand what that is, where it is, who owns it, and is it secure? Because particularly with a work at home remote workforce, a lot of organizations have moved to, what you've done in effect, and a lot of people won't like to hear this, it's you've extended your corporate network into people's homes. If you have a device that's on someone's personal Wi-Fi with your cable company or whoever, using a router that you bought at a garage sale, and we have no idea how secure that is, that's a risk. And so organizations really need to understand what that looks like, and then maybe think about how to how to remediate some of that. As we go through, another thing that's a major part of this is taking a look at individual risk items. So at BluTinuity, we've got a risk management register tool, and it's a spreadsheet model that looks at over 125 common risks. As an organization, you may bring a list of risks. Maybe you have a matrix like this, and that would be fantastic. But we want to cover a lot of different areas across technology, physical facilities, people, business risks, and put it into a scoring system so that you can understand, and prioritize what your risks are. I use a model that calculates likelihood and impact, and a factor that I call velocity, which is how quickly the risk reaches its maximum effect. And we multiply those, and you ultimately end up with a weight or a rating and you can categorize this as a high, medium, low, or a critical risk, something of that nature. And then as you do that, what you start to find out is that you become uncomfortable maybe with some of the scoring. Like, for instance, we talked about ransomware, and if your ransomware scores say this is a critical risk and you've really not attended to it, no one's had any discussions internally at a leadership level about how are we going to better prepare ourselves for ransomware, then that's a question that needs to be asked.
Right.
Are you ready to accept that risk? Because now you know that this is bad news. And so you process through, is it okay if our antivirus software doesn't work, and, on and on and on, ultimately to get to a point where people can sleep at night. Because if you have 100 risks on here and you can't accept the risk because you look at it and you say, gosh, this is really too high, this is scary for me, then the organization learned a lot, and it's time to get a team together to start working through some of these. Another thing that may be included, sometimes an SRA will include a technology focused assessment, a vulnerability scan, where we take a look at, are there vulnerabilities or missing patches on devices,
Right.
and bring some information back. That's sort of an optional thing. Or a penetration test is another component. Typically, that's an external consultant who is hired to attempt to break into your system,
Yeah.
in effect, and then give you a report back. So, and all of those, all this information that we pull ultimately goes into a deliverable report. We'll have some conversations after about, what the next steps are. And so that's kind of a deep dive into what a risk assessment, very comprehensive risk assessment looks like.
Excellent. Excellent. Thank you for that. So there's a couple things that I wanted to pull out of that. It's not just that I think are important to understand. It's not just about the technology piece of it. That, a security risk assessment, you mentioned, physical facility, people, like it includes all of those aspects of it, and that's an important part to understand too, because your people can be just as big of a risk as your technology. When we're talking about phishing, for example, phishing is a
Absolutely.
really easy way to break into people's systems by just sending an email out to somebody that looks like it's from somebody within your facility, but it's spoofed, and suddenly bad actors are into your system,
Exactly.
right? So doing that type of testing, or even the facility. I know that having worked for EHR and EMR companies, where we have access to PHI facility. Security is really important. The idea of piggybacking, when you have badging into a facility and not letting people piggyback.
Piggybacking is
Yeah,
huge.
piggybacking. And for those of you that may not understand what piggybacking is when you badge into a facility, people that try to come in with you without badging themselves in. That's called piggybacking.
It absolutely is a security risk. And, if you don't know who that friendly person is who's following you into the
Yeah,
office, you need to know,
right.
because that there's always risk there if you don't understand. So,
Or it could even be a friendly person that you do know, but that person does not have access to that part of the building and shouldn't be in
right.
there. So there. Yeah, there's lots of different levels that you need to understand. So you know, building on that, what are some of the benefits of having a security risk assessment?
Well, I think most importantly is what I was mentioning in the last question is you essentially can't manage risk to the organization and your systems and your data, unless you take the time to understand and assess it. And once you understand your risk, you can develop long range strategies to improve your maturity and reduce and manage risk. The SRA basically gives you a baseline measurement. And you may find that there's some low hanging fruit. We can implement a policy in 2 hours and we can solve a problem. And sometimes it's more complicated. Sometimes you've got to invest, some significant dollars to get you there. But the scary part is if you don't know that you have vulnerabilities. If you have For instance, a laptop that's not checking in to get its antivirus updates, um, there's a vulnerability there that you need to make sure that you manage well. Other things that are benefits or reasons to do this. The SRA is usually a requirement to obtain favorable rates or any rate for cybersecurity insurance. And most organizations have cybersecurity insurance. The amount you cover depends on the size of the organization, the complexity, the data, and a number of things. But what I do know in helping organizations negotiate some of these contracts is that your level of security maturity matters when it comes to the dollars that you spend, and not just in premiums, but also your deductible. So that's an important piece. There's obviously a compliance component in healthcare. This is a requirement of HIPAA. Straight up, whether you're a covered entity or whether you're a business associate, you are required to complete one of these on an annual basis. Now, it HIPAA does not lay out exactly what that the format or the structure or the requirements. So you have a little bit of flexibility to go to structure it however you see fit, as long as it complies with good practice. If you ask two questions and you had two sentences and you turn that into the OCR and say, "Here's my risk assessment," they're going to laugh you out of town after they fine you, perhaps. But so you have to do a reasonable job on that, and those would probably be the major things that I would look at. I always encourage organizations, do the right thing. Don't be driven purely by compliance. Compliance is important, but you can be fully compliant with HIPAA and still have a frightening security incident because there was a hole in your security. HIPAA was architected and signed into legislation almost 30 years ago. And when that was put into place, a lot of the things that we take for granted today, no one had even thought about. Wi-Fi didn't exist. Smartphones didn't
Hmm.
exist. Bluetooth didn't exist. All of the ransomware, the list goes on. And so it's important to recognize that the world changes. And in order to stay ahead of the game with your risk assessment, you really have to understand what's current in today's risk and threat models.
Absolutely. So what you described in terms of what a security risk assessment is, it's very deep, it's very complex. So how much work or how much time is it for an organization to go through a security risk assessment process?
Yeah, I think it depends on the approach that you take. If you're going to undertake this by yourself on an internal basis, you probably could expect to spend upwards of 60 to 80 person hours combined in doing a really comprehensive review, talking to all the people that are involved, reviewing documentation. I guess perhaps less if you didn't put together a final report like a consultant typically does, but it's a fairly significant exercise. If you hire someone to assist, what you end up with is, the time to gather documents on the front end, interviews, which could be anywhere from 6 to 12 hours worth of time, depending on the security framework, and then some follow up later. So, one of the benefits you get by hiring a consultant is probably less internal time, in addition to the expertise. But either way, and HIPAA does not require that you have to hire outside, but you may find great value in doing so. I guess the most important takeaway here is this is not just a team meeting on a Friday afternoon to walk through a checklist. The risk register exercise that I mentioned earlier might be a half day with your team in and of itself. And I mean, if you're going to go deep enough to give you the kind of data that I think you'll need to make some smart decisions at the end.
Yeah, it's not going to be a checkbox exercise. You're just going to do yourself a disservice by approaching it that way.
Absolutely.
Okay, so how often should you be doing security risk assessments?
Well, the best practice, and I think everyone in the security world would share this viewpoint. Best practice is an annual risk assessment, something comprehensive like this. HIPAA and some of these other frameworks, they don't come right out, in the language and say thou shalt do one every year, every 12 months. But really, if you think about all the changes to the organization that are made in the course of a year, new servers, new software, every time you make a change like that, it changes your risk quotient. So it really is important to take a look at this annually. And there may even be some risks that need attention more frequently. When we talked earlier about the ransomware, if you identify that ransomware is a critical risk to the organization, it's probably a good idea that you're spending, maybe that's a quarterly review to circle back and say, are we still comfortable? Have we done anything? Have we done all we can do? Whereas low risk items like, what's the risk of the internet taking us down? If you've got redundant connections with different internet carriers, you might say, well, based on the controls that I've put into place, the risk is very low. So we don't need to talk about this for another 12 months. And even in the 12 months, we don't really need to talk about it. If things have changed, we can keep the score to where it is and move on. So I think it's good practice that an organization is in maybe a quarterly rhythm, but not everything reviews at that level. The big one happens annually, and more important things, are brought to the table more frequent.
Excellent. So, Scott, you've conducted hundreds of security risk assessments. What is the biggest mistake you see organizations make when going through the process?
I think probably the biggest mistake is maybe not during the process, but right after the process, and not taking information security seriously. And I've worked with organizations that have reached out and said, I've got an audit coming or a compliance deadline, or one of my clients has said I have to do this. And we started having a conversation, and they have nothing. They have no policies, no procedures, no controls. They don't understand password management. I mean, the list goes on. And in a case like that, you wonder sometimes how they haven't already been a victim of some serious incident. And it's going to take a long time to get to a point where you're in a good position. As I mentioned earlier, organizations regularly are victims of cyber attacks, and some of them very serious. And to not take these things seriously is a big mistake. I would also probably say that the one of the single greatest vulnerabilities to an organization is people in general. Now, that's people is not a specific risk, and you wouldn't be scoring the word people in your exercise. But if you put phishing attacks, social engineering, which is any sort of, trying to get someone to give information that they have that shouldn't be given to the person on the phone or the other end of the email or text, and stolen or compromised credentials, if you put those attack vectors into one bucket, that accounts for about 40% of all security incidents from 2023, according to that IBM Ponymon survey that I mentioned. That's a significant amount that you can attribute just to one classification. And the interesting thing is those are all areas where awareness and training can have a very strong positive impact. So if an organization hasn't gone through a security risk assessment and they don't know what their training needs are, and they haven't been able to connect the risks that they've talked about to the training, they may not take the time to educate users as they should, and they leave a big opportunity on the table. I think right now, this changes over time. If you would ask me the same question 5 years ago, I may not have said the greatest vulnerability is people, but the sophistication and complexity of some of the attacks that I see with people is remarkable, and the way they can trick people into giving up their credentials and their multi-factor authentication
Hmm.
codes, and take over accounts, and then move from a user account to an administrative level of privilege in the network. It's amazing. I've unfortunately been in positions where I can watch this in real time as working with some of my clients, and the speed and the targeted nature, the way these guys cover their tracks, it's really remarkable. This is not some teenager in a garage hacking his way into your network. These are crime syndicates in countries that don't like the United States, coming after healthcare data. And so, training individuals, training your users is really important. And like I said, if an organization doesn't understand what their needs are or some of these risks through the risk assessment, they're missing out on an opportunity to really affect their maturity.
It's a little bit scary. Well, it's not a little bit scary. It's very scary, the sophistication of, the phishing attacks that you see. We get it quite frequently, and I mean, they're really, really good. It's looks so genuine when it comes in that, sometimes you just have to take a step back and go, "Ooh, that looks real." It looks
It
very real. So it's easy to see how people are tricked into providing the information.
Yeah, the bad guys do a really good job of making their phishing attacks seem realistic, and they use tactics such as urgency,
Yeah.
and making a message look like it came from someone important in the organization,
Mhm.
and deflecting to say, this is so and so, the CEO. I'm just about to get on a plane,
Yeah.
so you can't reach me. Don't bother to text. But if you could wire $20,000
Right.
into this account, we have a new vendor. Everything would be wonderful.
Right.
And so now the CFO is left with, well, I don't want to disappoint my boss, but at the same time, I this is not a usual request.
Mhm.
And yeah, they're very sophisticated.
Mhm. Yeah. It's scary. Okay, so any final thoughts that you wanna leave the audience with today?
So I would love to share with your listeners, Allison, that a mature information security program really starts with a security risk assessment. You've got to measure, and put yourself in a position where you can pull pieces out. Sometimes it may take a while, maybe it's a year to fully implement all the improvements that are needed, but really, in healthcare particularly, but other industries too, protecting your data and your assets is one of the single most important things a company can do, and it's a cornerstone of continual improvement, to have that security risk assessment, which gives you the baseline. And that is all the data that you really need to get started on improving your program. And I just can't stress it enough. It is one of my passions, I would say, but I think with good reason. You can't start to manage your program well unless you know where you're beginning.
Scott, if people want to, learn more about BluTinuity, how can they get in touch with you?
Absolutely. I would invite them to go to my website, blutenuity.com, and that's spelled BLUTINUITY.com. And there's a contact page. You can fill that out, and it'll send me an email and provide your contact information. My website also contains pages that describe not just the security risk assessment, but some of the other services that BluTinuity can assist organizations with. So that'd be a great way to reach out to us, and we would look forward to understanding your organization and helping in any way we can.
We are out of time for today, but I want to thank you so much for joining us. This has been a wonderful discussion, so much great information for our audience to take in. Security can be a scary topic, but there are things that we can do to make sure that we are making our organization safer. And you have given us a lot of great things to consider today. So thank you so much for joining us. We really appreciate it. And thank you to our audience for tuning into the Therapy Matters podcast, your one-stop resource for expert insights and advice on everything therapy and rehab. We look forward to seeing you on the next episode. Thanks for listening to Therapy Matters. Do you like the podcast? Give us a 5-star rating, subscribe, and tell all your friends about the show. Want to be a guest or know someone that would be a great guest speaker? Contact me at allison.jones@raintreeinc.com. That's allison.jones@raintreeinc.com. Therapy Matters is brought to you by Raintree, therapy and rehab's favorite EMR. Raintree is the only all-in-one therapy EMR delivering a complete and seamless end-to-end patient journey, from first contact to payment to patient retention. To learn more about Raintree, visit us online at raintreeinc.com.